Hello everybody, thank you for tuning in to another one of my videos. Just before I get into the meat and potatoes of this video, if you like my content, if you wouldn't mind just taking a minute to like or share or comment or subscribe or whatever is appropriate on the given platform that you're watching this video on, I'd really appreciate it. Just nice to see some love for my channel and just helps to get my information out to more folks who might need it. So thank you for taking the time to do that if you don't mind. So somebody posted a question on one of my other videos recently. It was in regards to the interview that I posted recently where I had the opportunity to talk to Dr. Jill Krista, one of the experts of mold in mold illness out there in the world. And the question was around something that, well, I'll just read the question here. So it says, what does Dr. Jill Krista mean by PANDAS caused from Lyme? I know what PANDAS is. I thought it was caused by strep. Thanks. So I'm assuming either Dr. Krista slightly misspoke or maybe there was a miss here. I don't know. I didn't go back and listen to the interview because I was there and it was amazing and I have too many other things to do. But what she would have been referring to is that, yes, strep is what causes PANDAS. PANDAS has strep built into the name, pediatric autoimmune neuropsychiatric disorder associated with strep. So strep being in the word, but what she would have been referring to is Lyme potentially being a potential cause of PANS. And so PANS is basically PANDAS that's caused by something that's not strep, essentially. PANDAS is under the umbrella of PANS, but basically it's something else that's triggering this autoimmune condition that's causing this neuropsychiatric disorder in kids. So in my experience, I've had worked with many patients with PANS, and some of them it's definitely related to strep, and some of them it's definitely not related to strep. And sometimes, as best we can tell, it is related to the Lyme bacteria, either typically that would be in its chronic form, not regular old Lyme disease, although it could potentially be triggered by that, or it's caused by some other type of chronic infection, whether it's Bartonella or Babesia, Mycoplasma. It's sometimes related to non-infectious entities, so it could be something like mold toxicity, could potentially be related to other toxins, heavy metals, things like that. So PANS is just really, really broad, but unfortunately it can be, it's just as potentially devastating as PANDAS. So that's what Dr. Krista would have been referring to when she mentioned that. So for anyone listening who might know someone who is affected by PANDAS, and if they're in, as per usual, this is not medical advice, this is for informational purposes only. If you need medical advice, please talk to your clinician to get that advice. If there's someone who has PANDAS and they're being treated for PANDAS and they're not getting 100% better with that treatment, it may be because there is something else that's contributing to their presentation. They may have PANDAS and something else that's causing their PANS. So it's strep and something else, or maybe it's something that's not strep at all. When we look at some of the treatments that are used for PANDAS, oftentimes it's antibiotics or antimicrobial herbs. And if a patient's getting better on those and they fit the prescription of PANDAS, like, oh, it must be PANDAS. But some of the antibiotics that are used to treat strep can also sometimes treat Lyme. They can sometimes treat other infectious microbes, just as the herbs we use. As I've said in many of my other videos in the past, a lot of the herbs that we use to treat Lyme, treat Bartonella, treat Babesia, treat Mycoplasma, treat viruses, so there's just a lot of spillover. And so one of the therapies that can allow us to get more insight into what the causal microbe is one of my favorite therapies, low-dose immunotherapy, or LDI for short. Posted a lot of videos about that before. I talk about it semi-regularly, because then in that case, if the child is on a certain protocol, they're doing better, and they've hit a plateau or they've improved, but now the improvement's kind of going a bit slow, well, then in that case, we can bring in an LDI formula for, say, strep. And if the patient gets dramatically better with that, well, I guess it must be a strep component. Whereas if we give the LDI formula for Borrelia, which causes Lyme disease, and the patient gets dramatically better, then it looks like it was probably related to Borrelia. Or we can do the same thing with Bartonella, Babesia, yeast, whatever it happens to be that we might use. There's lots of LDI formulas. So we can, in my clinical opinion, in my experience, I think that we can get additional insight into the cause of what's driving the PANS in those patients who are not responding 100% to the treatment for PANDAS, if maybe there's another causal microbe. So thank you for the question. If anybody has any further questions about this topic or anything else, just post it in the comment section below and I will answer as soon as I can.